Hey everyone, welcome back to The Explainer. Look, if you're the kind of person who really wants to understand how your body works, you are in the perfect place. Today, we're talking about something so many of us go through, but honestly, almost all of us ignore it. I'm talking about joint pain and stiffness. You know, that dull ache after a long day, or maybe your fingers feel super stiff when you first wake up. It's so incredibly easy to just brush those feelings off, right? Like, oh, I'm just tired, or well, I guess I'm just getting older. But what if your body is actually trying to tell you something much more important? Okay, so let's dive into this. Honestly, as we were putting this explainer together, it really made me stop and rethink some of my own daily frustrations. Like, are we truly just sleeping wrong? Or could you actually be experiencing the very early stages of arthritis? It's a question we almost never ask until the pain becomes unbearable. But here's the thing. Catching those really subtle clues early is absolutely the key to protecting your joints. Just to put this in perspective, according to the CDC, somewhere between 53 and 67 million adults in the US have been officially diagnosed with arthritis. But here is the truly staggering part. Researchers estimate there are up to 37 million more people out there who might have it right now without even knowing. 37 million. That is literally a silent epidemic. So many people walking around completely undiagnosed. And as we go through this today, you might just realize you're part of that group. So here is our roadmap for today. We're going to start by looking at this silent joint epidemic. Then we'll break down the difference between OA and RA. After that, we'll uncover the early warning signs, especially those red flags that show up right in your hands. And finally, we'll talk about how to actually take action. All right, Section 1, the silent joint epidemic, a widespread issue. The main reason we're doing this explainer today is because catching arthritis early is just absolutely critical. If you wait until the pain is severe, well, you might be looking at irreversible joint damage. Stepping in early is what preserves your joint function and actually keeps you moving. And if your joints are aching right now and you're feeling a bit alone in this, check this out. 528 million people globally are affected by osteoarthritis alone. That's more than 7% of the entire planet. So your pain, it's incredibly valid, and this condition is wildly widespread. You are definitely not the only one dealing with this. Moving right along to Section 2, OA versus RA explained. Let's get to know the difference. Now, what's really interesting is that arthritis isn't actually just one thing. It's an umbrella term for over 100 different conditions that cause joint inflammation and stiffness. But to really get what's happening in your body, we need to focus on the top two. First up is osteoarthritis, or OA. This is essentially a wear and tear situation. Think of the cartilage in your joints like a smooth, protective shock absorber. Well, over time, that cushioning just gradually wears away. And when it thins out too much, your bones literally start rubbing against each other. Ouch, right? That mechanical breakdown is exactly what causes the pain and the stiffness. Now, in stark contrast to that, we have rheumatoid arthritis, or RA. This is not a simple mechanical wear and tear issue, not at all. RA is an autoimmune disease. This basically means your body's immune system gets confused and actively starts attacking its own healthy joint lining, which is called the synovium. And that triggers this massive inflammatory response. Understanding this difference is huge because it completely explains why RA feels so entirely different from, say, a simple muscle ache after a hard workout. Your body is literally fighting itself.
Section 3, early warning signs. It's time to really listen to your body.
So what are the specific bodily clues that signal it's time to stop brushing off the discomfort? Well, a crucial thing to look at is the timeline, specifically 6 weeks. According to the Arthritis Foundation, if you've got persistent joint pain, maybe some tenderness or swelling that lingers for a month and a half, that is a massive red flag. We're not talking about the soreness you get from working in the yard all weekend that fades in a few days. No, this is a dull, achy pain that sets up camp and simply refuses to leave. Let's talk about your morning routine for a second. How long does it take you to actually get moving? I didn't realize this before, but feeling a little stiff for a few minutes when you roll out of bed is actually totally normal. But if you find yourself regularly taking 30 minutes or more just to loosen up your joints so you can start your day, that is a prime indicator of inflammatory arthritis. And with RA specifically, that morning stiffness can easily stretch out for well over an hour. Have you ever bent your knee or maybe rotated your wrist and felt this weird grinding or grating sensation? Or maybe you literally hear a popping or clicking sound. Well, medically, there's a word for that, crepitus. It's the physical, mechanical result of that smooth cartilage breaking down. When you feel that grind, you are actually feeling the compromised cartilage surface and sometimes even actual bone-on-bone contact. And this next point brilliantly illustrates just how systemic rheumatoid arthritis really is. Things like extreme fatigue, a low-grade fever, maybe even losing your appetites, these things often show up before the severe joint pain even starts. Why? Because your immune system is working overtime and it demands a massive amount of energy, which just leaves you totally exhausted. Also, notice the part about symmetrical joint symptoms. If both of your wrists hurt or both of your feet are sore at the exact same time, that symmetry is basically your immune system's subtle cry for help. Which brings us to Section 4, red flags in your hands, crucial early signs.
Our hands have these really small, highly mobile joints, and since we use them constantly, they are prime targets. In fact, early symptoms of both OA and RA most frequently begin right at your fingertips. Now, we need to draw a hard, unmissable line here between just typing way too much on your laptop and having an actual arthritic condition. If it's just overuse, it usually resolves in 1 to 3 days, and it's almost always specific to the hand you use the most. But arthritis? That persists for weeks. It's worse in the morning or after you've been resting. It often affects both hands, and the swelling just doesn't go away.
Over time, osteoarthritis actually causes physical, visible changes to your fingers. You might start to notice bony lumps forming at the very tips of your fingers. Those are called Heberden's nodes. If those same lumps form at the middle joints of your fingers, they're called Bouchard's nodes. This is a classic sign of cartilage loss in OA. Now contrast that with RA, where you're much more likely to experience redness, warmth, and puffiness in those large knuckles right at the base of your fingers. I want you to think about your own daily tasks right now. Are you suddenly struggling to button your shirt in the morning? Is it getting incredibly difficult to just open a jar from the fridge? Do you feel weakness or maybe a bit of clumsiness when you're just trying to hold a pen to write something down? Look, if you're having difficulty making a full fist or if you're noticing puffy knuckles, these are very direct, very early indicators that your hand joints absolutely need some attention.
Let's move to Section 5, taking action and treatment. How to protect your joints.
Because honestly, just knowing these signs is only half the battle. Catching them early is what unlocks your options to preserve your joint function and basically get your life back. Even before you see a doctor, you can kind of self-identify your own risk level looking at this CDC data. Age is obviously a big factor, with 54% of adults over 75 reporting arthritis, though keep in mind it can strike much younger people too. Women actually have a higher rate than men. And if you have a family history or carry excess body weight that puts extra stress on those joints, or maybe you've had previous injuries like a torn ligament, or even just a job that requires repetitive hand use, your likelihood of developing arthritis definitely goes up. Now, let's talk about the doctor's visit, because I know it can be a bit intimidating to go in. Let's demystify how this actually builds. Step 1 is super straightforward, just a physical exam of your joints. Step 2 involves some basic blood tests. They're just checking for specific inflammatory markers or something called the rheumatoid factor, which helps identify any autoimmune activity. And finally, step 3 is imaging. This means X-rays or an MRI, so they can actually see what's happening to the cartilage inside. See? That's it. The whole shebang. Really nothing to be afraid of. Once you actually know what you're dealing with, well, here is the standard medical toolkit to fight back. It usually includes anti-inflammatory medications or maybe specific disease-modifying drugs if you've been diagnosed with RA. Physical therapy is absolutely incredible for keeping your range of motion intact. You've also got low-impact exercises like swimming, weight management to reduce the everyday load on your joints, hot and cold therapy, and even wearing splints for your hands and wrists. All of these can massively improve your day-to-day quality of life. And here is some really great news from our research. Medical science has advanced way beyond just taking pills or getting invasive surgery. For example, there are clinics like CMAD Region down in Alpharetta, Georgia, that focus entirely on treating joint pain right at its source without those lengthy, painful recoveries. They're using highly targeted, advanced joint injections, things like platelet-rich plasma, hyaluronic acid, and corticosteroids. They offer dedicated, highly customized care plans specifically for stiffness, plus comprehensive pain management designed to keep you out of the operating room entirely. So, what does this all mean for you? We've covered a lot of ground today, but I really want to leave you with this final thought. Your joints literally carry you through life, but they can't heal themselves once that cartilage is completely gone. If you've been nodding along to the symptoms we discussed today, please don't just brush it off as aging anymore. Will you wait for the pain to worsen, or will you take action and seek a professional evaluation to protect your joints today? The choice is entirely yours. Thank you so much for joining me for this explainer, and as always, keep learning.